medicated one, so I'm not too sure what is the management.
It's okay. So what medication she's on?
He's on, so there's two quite rare medication, Bosentan and Selexipag. Otherwise, he's also on digoxin, sildenafil, Lasix, and spironolactone.
Okay.
That's good.
Alright. So I'm not gonna ask you about pulmonary hypertension. I'm gonna ask you about the heart failure. So out of those 5 drugs, which one is for the heart failure?
For the heart failure is Lasix
And
digoxin.
okay, some more.
Spironolactone also.
Okay. So what is heart failure?
Heart failure is when the blood cannot supply the the blood supply is not sufficient.
Okay, it's a condition where your heart unable to meet your oxygen demand lah. So heart cannot pump efficient enough to meet the metabolic demand. That's the definition of heart failure. Okay, alright. So what are the symptoms of heart failure
Shortness of breath.
in big children? Okay, shortness of breath. Some more.
Leg swelling.
Shortness of breath, leg swelling lagi. Shortness of breath all the time or?
Especially during activities.
Okay, alright. Some more. What else? Heart failure symptoms in smaller children. They don't have leg swelling. What are the symptoms and signs that they present with? Ascites, big children, chronic one, yes, but not in small children, not in babies. Okay, so in small babies, small children, what are the common presenting symptoms and signs? Coughing, not so, probably, but not the first one I'll answer. So okay, if we talk about babies, what are the symptoms that they will have if they are in heart failure? Tachypnea, yes. Some more? Lethargic in sense of what? How you measure that? What activity they do it? What?
Less feeding.
Okay, less feeding. Some more?
Reduce urine output.
Reduce urine output. No.
Less feeding, less active.
What else about feeding?
Cannot tolerate.
What do you mean cannot tolerate? Is it really cannot tolerate?
More vomiting.
No.
Less feeding.
So if they feed, how long the baby feed in normal babies? How long can they finish the feeding? One bottle to how fast can they finish?
Minutes.
Sorry?
In minutes.
Yeah, how long usually?
10, 20.
10 yes, 20 no. Okay, so what about the timing?
So babies and heart failure
Prolonged feeding time. Okay, some more. What else during feeding?
Be more breathless.
No, more tachypneic during feeding. Okay, some more.
They won't finish the whole bottle.
Yeah, okay. Difficult to finish the feed. Okay, some more. If they're breathless, what do?
They'll stop feeding.
So interrupted feeding lah. So that's why it become very prolonged. Okay, alright. So if you have poor feeding, what gonna happen to the weight?
Poor weight gain.
Poor weight gain. Okay, alright. So poor weight gain. How baby should gain how many gram a day? No, don't know.
Depending on the age.
Yeah, in babies, in 2 3 months of age.
Normal weight will be less, will be 0.5 per week.
0.5 what?
0.5 gram. Is it per day?
Per day, per day berapa gram per day?
0.5.
No, not 0.5. Tak pernah dengar lah 0.5 ni. Okay. Alright, they should gain 25 gram per day at least. Okay, so poor weight gain. Okay, what else? Other symptoms suggestive for heart failure in babies. If they tachypneic, why do they become tachypneic? Other than you bagi feeding, what other reason?
Because the heart is not pumping enough blood to the lungs.
Is it not pumping enough blood to the lung? So there are two mechanisms of heart failure. It's either volume overload or pressure overload. So if you have too much volume going to the lung, what going to happen to the lung?
Pulmonary edema.
Yeah, so there's a lot of water going to the lung lah. So you got pulmonary edema. So that's why they become tachypneic. Alright. So but in pulmonary hypertension, is it volume overload or is it pressure overload?
Hypertension.
Pulmonary hypertension. Pressure overload. In which side? Right side, left side?
If in pulmonary,
Yeah.
right side.
Right side. Okay, so in this patient that you presented, the heart failure because of the left side heart failure or right side heart failure?
Right side.
Right side heart failure. Okay, so if you have your right side heart failure, if you do your examinations, what else can you see? Other than you already mentioned leg edema, you already mentioned what else can you say? Ascites, you already mentioned ascites and edema. Those are right side heart failure lah. Okay, what else? Raised JVP and some more. Liver?
Liver hepatomegaly.
Okay, lung?
Lung will be edema.
So on auscultation dengan apa?
Auscultation, you hear crackle.
Yeah, you hear crackles lah, especially at by vessel lah. All these big children can have lah. Small children, probably the lung is clear, but they are tachypneic. Okay, so if you have lung flooded in small children like that, if you have a lot of water inside the lung, that one predisposed patient to get what?
Infection.
Yes, so recurrent lung infection also the signs of heart failures. Alright. So that's why sometimes we see atrial septal defect patient, ventricular septal defect patient, recurrent lung infection. We also refer for closure lah. Okay. Even though good weight gain, they may not have overt heart failure symptom, but this recurrent symptoms, recurrent lung infection is probably enough to make us refer for surgery or whatever intervention it is lah. Okay, so in heart failure, so how do you manage? You start with investigation first, biochemical dengan radiological.
So biochemical, blood markers for heart failure will be proBNP.
Okay, some more?
So for example, in his case it's this, but I'm not sure. Usually it's for MI.
Ada heart failure pro-NT-BNP, anti-pro-BNP sama. Ada common blood investigation you said?
Other common with MVC.
So MVC nak tengok apa?
Look at the hemoglobin.
What about hemoglobin and heart failure?
In heart failure, they might have increased HB to compensate.
Okay. Increase HB to compensate? Not really. In sinuses, yes. What about anemia and heart failure? Can you allow anemia in heart failure patient?
No.
No, then because you increase the heart workload. Okay, so you probably want to aim a normal HbA. Okay, platelet white cell count probably not much. So, what else are the investigation? Renal profile, you want to send or not?
Yeah, renal profile.
To look for what?
Look for.
Nak tengok apa?
Sodium, that's it.
Why?
Because it can affect the fluid retention or that.
Okay. What other reason? Some other reason want to look at the sodium and potassium? Think about what this patient also has. What medication patient has?
Oh, yes, it's on diuretics.
So on diuretics, what can happen?
cause spironolactone can cause
Hyperkalemia.
hyperkalemia.
Then furosemide can cause what?
Furosemide can cause hyponatremia.
Okay, hyponatremia. Some more? Hypo what?
Hypokalemia.
Yes, hypokalemia as well. Alright, then what happened to the urea and creatinine? The patient on diuretics.
Creatinine will be raised.
Yeah, it can be raised lah because furosemide diuretics, the main function is to what?
To get rid of fluid.
Yeah, get rid of fluid. So sometimes you get rid of fluid too much, then you get AKI lah. Alright. So sometimes even in heart failure, the heart pumping is not good enough. Your kidney perfusion also not that great. And probably there is some AKI as well. Okay, especially if ejection fraction is less than 20%, for example lah. So sometimes perfusion to the kidney not good, then you probably get heart failure. Probably lah. It can happen. Alright. Okay, so RP, ABC, RP, LFT, want to send? Want to look for what?
You can look at albumin.
Okay.
LFT to the
Albumin can, but albumin is will tell you the nutritional status of the patient lah. Okay, if patient is well, albumin is low, mean patient is probably under nutrition, not enough nutrition. So you want to aim a good nutrition, give high calories, because when you are in heart failure, you are using a lot of energies because your heart pumping more. It's like you are on marathon 24 hours because your heart is pumping at higher rate, tachycardic. So you use up more energy. So you want to get enough nutrition lah as your part of management. So albumin will tell you the nutrition status lah. Okay, but if patient is sick, albumin also can be low. Alright. So specifically for heart failure, what else you see on the LFT? Think about right side heart failure. Why they have hepatomegaly? Right, why they got hepatomegaly? Why they got raised GVP? Why?
fluid overload.
Okay, fluid overload. Some other reason? So fluid overload causing what? Edema is one. Another reason is liver congestion lah. Okay, so there is congestion because of heart not pumping. So you got backload. So overload backload to the JVP, IVC, SVC lah. So SVC, then you get rest JVP lah. IVC, you got jam over there. You got liver congestion lah. So if liver congested, what gonna happen to the liver enzymes? Raise. So which liver enzyme akan raise? ALT, AST, ALP.
ALP.
Okay, some more.
ALP and ALP.
All can be raised lah. Okay. Sebab all liver enzyme will be released from the liver lah. Sebab everything is congested, so everything is like stretching your liver, then it gonna be released lah. Probably not very high lah, but if more severe the heart failure, more likelihood lah they will have higher transaminases. Okay, so ABC, RP, LFT. What else you want to send? Calcium, magnesium, phosphate. Can lah. Alright. So tapi okay, I don't want to ask more difficult question. Alright, then chest X-ray nak buat ke tak?
Yes.
What you want to see?
You can see cardiomegaly.
Okay, so cardiomegaly in children, cardiothoracic ratio berapa? Berapa ratio yang you belajar waktu medical student dulu? Same cardiomegaly. Two-third. Sorry?
Yeah.
Two-third. Two-third in point berapa?
0.6.
1.6 lah. More than 0.6 is cardiomegaly lah. Okay. What else you see other than cardiomegaly? That one, the heart, the lung on the chest X-ray. What else you see?
The lungs, so there's pulmonary edema, so could it be line?
Yeah, can. So increase in pulmonary what?
Increase in pulmonary.
Increase in what marking? So imagine you have increased blood flow to the lung due to VSD, for example. Alright, then you have your blood vessel dilated. So on chest X-ray can nampak apa?
Increasing hyperinflated. No, not hyperinflated.
No.
Increasing.
Pulmonary vascular markings. Yalah, you akan nampak the vasculature is much more prominent lah. On top of it, you see lung looks plethoric lah. Because of the increased pulmonary vascular marking. Okay, alright. Then, okay, habis lah investigation. What else? So what else can you do as investigation? Bedside investigation. Apa lagi yang ada you can do? What did you do yesterday?
Echo.
No echo. Before echo. Bedside. Echo not really bedside. Huh?
Kita scan.
No. No. Bedside. ECG lah. So ECG what can you see?
ECG. In heart failure.
In heart failure, let's say VSD. So you said cardiomegaly. So akan nampak apa? ECG nampak apa?
Like the tall waves.
Tall wave, tall QRS punya wave tu. So what does it indicate? What chamber dilated?
The ventricles.
Yeah, so can be LVH, can be RVH, depends on the condition lah. So in pulmonary hypertension, which side akan dilated? Right ventricular hypertrophy or left ventricular hypertrophy?
Heart failure will be
Pulmonary hypertension. RVH or LVH do you see on ECG? Pulmonary hypertension, right side or left side?
only will be right heart failure.
Right failure. So you see RVH lah. Right ventricular hypertrophy is probably one of the symptoms you can see. Okay. Then or heart rate. You see patient in heart failure, bradycardia, tachycardia. You need to pump harder. You pump more. So bradycardia or tachycardia? Tachy lah. So tachycardia lah. On ECG itu je jawapannya. Tak adalah yang susah sangat pun. Okay. Kena fikir sikit. Alright. Lepas tu ECG, echo you can do lah. So on echo it's the same thing, same finding you probably see lah. Kalau ada dilated chambers, kalau echo you buat in pulmonary hypertension, which chambers akan bengkak? Right side chambers or left side chambers?
On the echo,
Right side chambers dilated lah. Okay. Alright. So how you want to manage patient in heart failure? Start with how do we manage? How do we arrange management in children? Start with what dulu? First, we need that to be alive. So we need oxygen, right? So need airway oxygen support or not?
yes.
Yeah. So for oxygen, probably you want to support with oxygen lah. So that's so your heart work less hard. Okay. Alright. After oxygen support, next step apa?
Circulation. Sorry, breathing. So airway breathing.
Okay.
Then circulation.
Alright.
Then diuretics.
Dia airway breathing together, oxygen, then you punya fluids. This is how you plan your management. Airway breathing. Your airway which is oxygen support, whatever it is lah for the airway, then bukan pulse. Alright. So next thing you arrange your fluids lah. So fluids, you nak restrict fluid or what?
Yes, fluid restriction.
Fluid restriction lah. Okay. But in big children you can do it lah. But in small children, can you restrict too much?
No, because yes, is the major.
So why cannot restrict too much?
Because small children is they only get calories from fruits also,
Okay.
and they need the
So they use the calorie to do what also?
to function
To grow.
To grow.
Okay. Alright then. Fruits. Then total fruit tu you restrict depends on the patient punya age lah. Okay. Kalau ask you about total fruit, berapa total fruit in 1 year old and above, you pakai what formula? Tak tahu nama yang mana? Berapa ratus?
The one the first 10 kgs.
First kg apa?
First 10 kgs is
How you calculate? 100 lah. Okay, alright.
50 and 20.
Okay lah, so kalau you nak restrict based on the holiday cycle, you probably restrict lah 80% from it. Okay, then kalau baby yang less than 1 year old, depends lah. Kalau less than 6 months, total fluid normal is 150. So kalau 150 total fluid, you want to restrict, you nak restrict berapa? Kalau based on that total fluid 150, kalau kurang sikit from that, how much can you restrict? 120, yes. Okay, kalau total fluid dia 120, how much you want to restrict? 100 kan? Okay, that's fluid management lah. Okay, then medication. So medication, what you want to say? No, what you want to start? Diuretics lah. Okay, I clarified all the answers just now. So other than diuretics, other than Lasix, furosemide and Spiro, what other antifailure can you start if the heart failure still not well controlled?
Captopril.
Yes, captopril. Okay. So captopril also probably one of the medication you can start. So other than furosemide, ACE inhibitor, beta blocker, example?
Beta blocker, atenolol.
Okay, sama.
Bisoprolol.
Okay, sama. But we don't really use per se, but atenolol, bisoprolol as a medication heart failure lah. But no problem can use. But I think we probably prefer carvedilol or something like that. Okay, but if tak ada, boleh just start, tak ada masalah pun. Okay, alright. Investigation dah. Then the last kali nutrition. What about the nutrition?
Nutrition if babies.
In patient with heart failure.
If they are struggling to, if they macam sakit ni, then I guess insert rice tube.
Yes, insert rice tube. Okay. Sama?
I nak tanya one question. If coag kan, bila when do you want to opt? Like what is the you want to aim for how much weight or how old you want to opt or what?
It depends on if the PDA close and the perfusion to the leg is quite good, then we still can follow up and
PDA
see.
close, but perfusion still okay, then you follow up.
Follow up only lah.
Okay.
Alright.
Hello?
If the critical coag, then we have to do operation at least 2.5 kilo something like that. Tapi pergi IJN lah. In the meantime, you have to put prostin first.
You need 2.5 kilo.
At least 2.5 lah.
If perfusion good, then you follow up, then apa
Endpoint, if okay, then no need to do anything lah.
Oh, dia boleh besar.
Boleh besar. Sometimes they want to go bigger.
Okay.
Okay.
Hello.
Okay, put rest tube sama.
Oh my god. Okay. Okay.
Why do we put rest tube?
Next time wearing down, yeah, I'll let you know.
Okay, next time bearing down. Yo,
Oh my god.
320 ya. Okay lah, fine. Okay, sama-sama.
Because they struggle with bottle feeding. The interrupted feeding just now. So giving rice tube will help to give the appropriate nutrition.
Okay. On top of nutrition, you the one patient too? No, dehydrated. If they suck, if they sucking basically that's the only thing baby do. Okay. So you put rice tube, you bypass that sucking process, so they don't exert themselves. Okay. So they can grow their weight lah. Okay, then they can grow bigger, they can go for surgery, whatever lah. Alright, on top of it, if patient terkim ni and you feed during patient terkim ya, then high risk for patient untuk develop what kalau tengah terkim ni lagi minum aspiration pneumonia lah. Okay. So nutrition wise, calorie wise, how do you want to tackle? But poor weight gain sebab heart failure. So what's our strategy?
Formula
Okay, formula feed boleh, EBM pun boleh, but what are the common strategy that we use for patient heart failure? How do we increase the calories in the formula milk?
MCT oil.
MCT can, carbohydrate can. Okay. Side effect? MCT dengan
That can cause diarrhea.
can cause diarrhea. Okay. So, the patient have diarrhea, the other option apa pula?
If have diarrhea,
Ada option not to use formula plus MCT carbohydrate. What are the option? Kalau more than 1 year old, you can use high calorie milk. More, less than 1 year old also got high calorie milk. So what high calorie milk that you know of? The normal formula is not high calorie, it's standard calorie, which is 0.67 kilocal per meal. Okay, this one 1 meal 1 kilocal, so very high calorie. Contoh apa? Rafiq minum susu apa?
infantry.
Yes, infantry. Okay, infantry is one type of high calorie milk. Okay, ada high calorie milk apa lagi yang pernah dengar? Sagnum P. Dan kalau purple P.
Not sure.
Pediasure, tak pernah dengar?
Oh, Pediasure.
Pediasure also another high calorie milk. Okay.